Hi, thanks for being here. Let's talk. Okay, so welcome back. If you're back, welcome. If this is your first time, my name is Ndapula Shali, and today I have a special guest with me. I'm going to let him introduce himself. His name is Alex Ilunga. He's a doctor, and we're going to be talking about some really interesting stuff. But before we get into that, Alex, could you please introduce yourself? Tell us a little bit about yourself, what you do, and yeah.
Hey guys. My name's Alex Ilunga. I'm a medical doctor. Currently, I work between the Windhoek Central and Katutura complex. And yeah, I guess I just prefer going by Alex. I don't really like the doctor thing too much outside of the hospital setting, but yeah. So I am, 26 years old. I'm a young male in Windhoek. I do YouTube as well. I have a channel called Third Space. It's generally a medical channel, but we just sort of try to educate people on like random health facts and stuff. So that's a little bit about me.
Okay, so the Third Space, I'm gonna post it down here, a link to the channel down here. It's really interesting. I came across Alex on Twitter, I think, when he put out the first video. Yeah. He contacted me when I put out the first video. I was talking about like mental health and stuff like that, the second video. And we decided that it would be great to collab because we're sort of speaking, our channels are speaking to each other. I'm more on like an advocacy type of role, but he's more professional and knows way more than I could ever. So I thought it's good to have some professionals on here who would know and who can guide us and inform us about mental health. So just to get into it, I think I want to start off by, can you please define for us, right, or explain to us in very simple terms, because tell us about what is the difference between a personality disorder, a mental illness? Is it the same thing? Is it not? Personality traits? Maybe you can, yeah.
So personality disorders are a form of mental illness. Mental illness, of course, is just a broad term for defining psychiatric conditions, basically, like your depressions and your schizophrenias. And just like those other conditions, personality disorders fall into that as well. And it's kind of like a mix of a bunch of stuff. You have, it's grouped into clusters like A, B, and C, and they all have certain things that relates to that cluster, but they also relate to other mental disorders. And I'll get into this a bit later. But personality traits, in a way, can be confused for personality disorders. But in psychiatry, the general rule is if you think something is a bit excessive, then it becomes a disorder. Like once it sort of passes what's socially accepted in that person's sort of cultural norm, then we start thinking, okay, maybe something is wrong with this person. But we always tend to self-diagnose. Sometimes you'll find yourself, you'll hear people saying things like, I have a little bit of OCD.
Yeah.
So that stands for obsessive compulsive disorder. But like, that would be, maybe they have traits of it, but they don't really have full-on OCD. Because when you have proper OCD, believe me, you would have been diagnosed quite a while ago. But again, once it starts going beyond the norm of what is socially accepted, is when it typically becomes a disorder. But a trait is more like, how do I explain? It's something that is recurrent within your nature, or something that is recurrent within your personality, right? But it doesn't cross those boundaries of what is socially accepted. Like, for example, let's just say Dr. Shali doesn't respond very well to jokes that are in poor taste, right? That is just normal. Lots of people would find a joke that's in poor taste to be not so funny or socially insensitive or something like that, right? But if we were to change that into a disorder, it would be something like Dr. Shali just responds poorly to any type of joke, for example. Right?
Okay.
So anytime somebody even just tries to converse with you or just tries to have like a light banter or something with you,
Mm-hmm.
you would just respond really badly, as though you were given something that was in poor taste. So you would just
Mm-hmm.
be somebody who you'll have difficulty integrating socially in any situation. Then it becomes a disorder, something like
Okay.
that.
So
Yeah.
you spoke about what's socially acceptable, and I like that you said that in your environment, because obviously our environments are different and
Hmm.
whatever. Okay, so my question is socially acceptable versus dangerous, or like a cause of, when does it become okay, by socially acceptable, do you mean like it's people just think it's weird, or like people are like a little bit concerned, or is it, do you then say elevate it to say, or escalate it to say like this is dangerous for you or others, or this is a counterproductive for your own life? How do we, I mean, social acceptance, I don't know if I'm like comfortable with saying, oh, because it's socially unacceptable, you shouldn't do this or that. How do we know then,
Okay.
is there another way of looking at something like it's like this is a disorder and it needs to be addressed?
It's a little bit of everything, really.
Okay.
Like, see, in whatever cultural context you're in,
Mm-hmm.
there is something that would be considered crossing the line or going too far, right?
Okay.
Even yourself as a person, once you're made aware of this fact, you'll probably
Mm-hmm.
agree as well, and you'll be like, okay, I did take that a little bit too far.
Okay.
So it is it's not, I wouldn't say subjective actually, because it's very objective, because everyone would be in agreement that that is a little bit too far.
Mm-hmm.
It's something like, let's say, so initially, right?
Mm-hmm.
If you what would be socially unacceptable? Something like stealing, right?
Mm-hmm.
I think it's generally accepted that acquiring somebody else's property without their consent, or
Yeah.
stealing or something, it's no, it's not something
Yeah.
you do, right?
Mm-hmm.
There, you can borrow someone's thing,
Mm-hmm.
but you'd have to return it,
Mm-hmm.
and nobody takes it well, basically, right?
Yeah.
The
Okay.
same way nobody takes violence well, the same way no one takes vandalism well.
Okay.
So if you have a disorder mentally, or something that changes your personality drastically to the point that like you go to the mall and start smashing up windows,
Yeah. Okay.
everybody around you will be like, that's a little bit too far.
Okay.
And unfortunately, that is to the degree that some of these mental illnesses sort of mess people up, because you act in a way that you don't see is really, really going beyond the line. Like
Mm-hmm.
extreme depression, for example, like somebody has to point it out to you that something is wrong here. And some
Mm-hmm.
people actually notice it themselves as well. But
Mm-hmm.
it's one of those things where you have to blatantly cross the line of what is culturally accepted amongst people that are in your immediate environment. So even your family, your kids, somebody would just be like, no, this is a little bit too far.
Okay.
And usually by that point, you're already, you've already crossed the line of needing medical attention or something like that.
Okay.
So it is, yeah, I think it's just one of those things that everybody would generally say, okay, I think something is really wrong. You just
Okay.
operate beyond the lines of what's normal.
All right. And so with that, I think before we get into actually defining and explaining for you, explaining personality disorders for us, I just want
Mhm.
to, I guess, plug here. If you can you, I was saying sometimes you can tell, and I agree that you also said this now, but I said it in an older video, that one of the earlier videos, that sometimes you know yourself, like if you're aware and you feel like something is off, you can maybe think, okay, I need to get some help. What happens when you
Yeah.
can't see that something's wrong? And like sometimes people tell you, and then
Mm.
you don't, I don't know, you don't want to accept it. I mean, it's difficult to accept something like somebody's telling you, hey, I think something's wrong with you, because there's all of this like, what is it called? All of this stigma around mental health issues. So
Yeah.
what then? What then if you can't see? Do people have like the ability or the right to if someone comes and sits down with you and you refuse, right? And no,
Yeah.
I'm fine. What then?
Yeah.
As a society, as a community, what do we do then?
Okay. So okay, this is now one of those where you sort of you're balancing between crossing somebody's autonomy and self-rights and all that.
Exactly.
But there is, okay, in psychiatry, there's a thing called insight, right? And it's generally how much of the disorder the person can perceive themselves. And it's also a measure of how well the treatment is going, depending on how is the patient's insight improving, right?
Okay.
Like on medication, can they now see that the way they were behaving before was quite like was quite aberrant, something like that, right? But that's besides the point, because there's generally when the person in a way that sort of as well, let's say they just start, like if you're on the road and you're driving in a way that endangers other people, we will all generally accept that you're not in your right state of mind, right? So there are sort of like there are court attributed acts or something that allow the state to sort of apprehend you if that is the case, and you become a danger to yourself or to others. You would be designated as somebody who's not in their right frame of mind, right? And someone like that, I think automatically your autonomy sort of falls to the wayside in light of the greater picture of just stopping you from whatever it is that you're doing, because that could harm yourself as well. And if you don't see it, we just classify it as the person having poor insight into what's happening.
Okay, so the line is when you're a danger to yourself or others. That's where the line is crossed. Okay.
I think so too.
Yeah, I think other than that, it's what you're saying about people's autonomy. I mean, we can't just step into someone's life and say you are weird and eccentric and now we need to lock you up. You know what I mean? So I think that's also something that people need to understand. Is like, if somebody's not hurting anyone or themselves, and you don't agree with their behavior, whatever, that's a different story altogether. But once they become a danger to themselves or they become a danger to others, that's when we need to step in and, like, as a community, because I really believe in community.
Yeah, because initially when no, I see what you're saying. And initially when whatever mental illness it is starting, it's usually in its like mildest form, right? And the idea even behind treating mental illness is to try to get somebody to a point where they can function again within society with that disorder, right? So if it's very manageable, then there is no point forcing that person into like a small room or forcing treatment on them or something like that, right? Because the idea is, we're trying to get you to still function within the confines of society. So it's definitely when it becomes like, if it goes to the extreme, then it becomes a matter of, okay, should we really force this person to go on medication because we're afraid of what they can even do to themselves. So yeah, once that line starts becoming quite blurry, I think that's when autonomy is lost, and then you start making decisions for the person via proxy or as a medical professional or something like that.
Okay, yeah, that's really good. As a medical professional, not just a random cousin from down the street who decides, oh, you're crazy. So I think it's very important to make sure that we consult medical professionals. We make sure we get advice from medical professionals how to help ourselves, how to help others before we start just acting on our own accord. Even if we think we're doing things for the greater good, or we're trying to help somebody, if there's somebody you're trying to help, get some medical advice first, get some professional advice first as to how do we go about this, because sometimes I think we also end up aggravating the situation. So if you're not very attuned to things and you don't really understand much, then somebody has like you see something is maybe you feel like somebody is struggling with something, or you see something's wrong, right? You can't show up and be like, hey, Alex, I think you're crazy, bruh. Did you see the thing you did yesterday? No one's gonna take it well, you know, or have these weird little interventions that you saw on YouTube, and it's like, we're sitting you down for an intervention because we think you're crazy.
Exactly.
Like, no one is going to handle that well. No one's going to respond to that well. So obviously you need to get some advice from a medical professional as to, okay, there's this person, they're exhibiting this, this, and this, and I want to help, but I don't know how. Can you guide me?
Yeah.
So yes, always go back to professionals. I always say that, especially with like mental health. I think it's very, very important. I mean, you wouldn't take your broken down car to a mechanic, to a accountant. You'll take it to the mechanic, right? Before you, or you wouldn't just go into a shop and go into BH and be like, let me try and see what might fix my car. You will take it to a mechanic so they can tell you this is what you need. Good.
Exactly. I mean, you have the right to be worried, but I think rather if you're in and out of your depths, I think get somebody who knows what is going on. Rather.
Yes, definitely. Okay, so can you tell us a little bit about then personality disorders? How we can identify them? What are they? What are the implications?
Okay. This is actually quite an interesting topic because I'm not the greatest fan of psychiatry, but I do find this set of disorders quite interesting as well. Along with psychiatry, I mean, along with schizophrenia and like mood disorders and other stuff. But so personality disorders are, I guess, in the simplest terms, disorders in someone's personality that don't really conform again to the norm. So you have, I think the best way to explain it is to classify them the way they're generally classified. And you can look this up. There's a thing called an ICD, or sort of like a DSM. They're kind of like manuals that we use for some psychiatric disorders, right? And you can actually just Google some of these stuff and just read it up.
I'll put some information in the description below.
Yeah. So there's personality disorders that are grouped into three main groups. Yeah. But they're called clusters. So you have cluster A, cluster B, and cluster C disorders. And generally they have themes. So cluster A personality disorders, we call these ones just easy ways for medical students to remember. These would be like, we call them the weird personalities. So we term these the weird. Cluster B are the wild, eccentric, and cluster C are like the worried, the anxious ones. So that's just a general broad term for the clusters. Now, I won't go too much into too many of them because some have quite a couple. But cluster A, for example, has a total of three main personality disorders. And these would be the paranoid personality disorder, the schizotypal, as well as schizoid personality disorders. Now, the main difference between these three, remember I said this cluster is sort of like the weird, in general. They act quite like the paranoid, for example. Yeah, these are people who feel like, and I'm sure you've met for almost all of these examples, and I feel like you've met at least somebody with one of or two of these traits. But these are people who feel excessively wronged by society or anyone really. They feel they're mistreated or they're abused, or they tend to mistrust a lot, even their partners to that degree. And this is where we get into the beyond what is culturally acceptable. Like they have no basis for some of their sort of like accusations, right? They just feel wronged all the time. Like if you are in a relationship with such a person, they could accuse you of cheating the whole time with literally no basis, right? They distrust a lot, and they just think everybody's out to get them. There's a thing called a paranoid or delusion of persecution, sort of that we use that falls into some mental disorders. And basically, they aren't completely deluded, but they do have this "everybody's out to get me" sort of mentality, right? So they're just paranoid that they're being like the world is out to get them in a way. And then the schizotypal is a little bit harder to explain, but I'll just touch on it a little. It's almost like people who have very idealized sort of thinking, magical thinking. They believe in like the deeper, more how do I say? They are they're the eccentric type of the group. They believe in things that are like let's say Dungeons and Dragons, for example, or they take an actual TV show really like relatively to the point, and they take it super seriously. And there's a little bit more. Sorry, I just have to quickly go back into it. But schizotypals are very they're very eccentric in all that they do. Yeah.
Okay.
And schizoid is sort of like a mixture of people who don't really want anything to do with people socially. Like they neither crave nor want social interactions with people. Okay.
Okay.
So the schizoid disorder, they neither want nor really crave social interaction. They're pretty distant and aloof. They try to keep to themselves. They don't really care much for social interactions. But yeah, that's just them in general. But in cluster A, I think the paranoid stands out the most. But yeah, like I said again, if you want like an in-depth difference between these guys, just check those manuals out that I mentioned. Like they give you point to point the exact difference between these personalities. So that would be cluster A. Cluster B is a lot more interesting actually, because these ones are like the typical stuff you hear in conversations, right? And these are people that I'm pretty sure you've definitely at least either seen a trait of or heard about. But people, personality disorders that that fall in cluster B are, for example, the narcissistic personality disorder. And I'm sure you've heard this term before in a movie or something, somebody being called a narcissist. But basically these people are, they are very obsessed with themselves. Yeah. They have inflated egos. They have delusions of grandeur. Like they daydream a lot about being like this important person, a superstar, like a celebrity, or something associated with power, money, you know. They only want to associate themselves with people of high value or high status, for example. Again, you'll see these traits in some people. Some people have the full-blown disorder, right? And they are insistent on people sort of like acknowledging them as being special. They constantly boast about their claims. They both, whether it's true or not, they just want to make themselves feel special and for people to know that they're special. But these same people lack empathy for others as well. So it's almost like this, I don't know how to put it. Say something like a Jesus complex, for example, yeah? They want to be viewed in a certain way, but don't really care much for people in the same way. They don't really care for people emotionally. As long as these people gratify them and give them the attention that they want, and inflate their ego, that would be somebody I would consider having a narcissistic personality disorder. And they would, yeah, I think these people you will blatantly see. They just, yeah, it's really out there. Another personality disorder would be within cluster B now, would be the histrionic personality disorder. This person is more histrionic, yeah. Yeah.
Never heard of that.
These people are. Sorry, should I spell it?
No, I've just never heard of it, but I'll look into it.
Never heard of it. Okay. Let's see if you've seen the traits before. This is someone who's generally also attention seeking, but on a more emotional level. They're very dramatic. Like they blow things out of proportion. They're always extremely theatrical. They're attention seekers in the best way that you can describe it. And sometimes even in the way they dress, they look for attention. They always seek for people to, they want to stand out in the room as well. So if they're not the center of attention, they're not very happy.
Okay.
On top of that, they also have they'll try to get attention in whatever way possible, including being like overly sexual or very seductive or something like that. They will really use whatever means they want to just to get that attention.
Okay.
So that would be the histrionic person, just super dramatic, super theatrical, tries to get attention in whatever way they can. And then there's two more. Oh, yes. So you have the, what's next? Oh, then you have the borderline personality disorder. This person is someone you probably don't want to be in a relationship with. They are, they have, they have extremes, like polar extremes of emotions.
Okay.
They are, let's say they aren't extremely needy or dependent, but they can portray, this is somebody who, for example, if you get into an argument with them, will tell you, I'm going to slit my throat after this, on my wrist, for example. They would use suicide as a threat. They always also want, again, these people want attention, yeah?
Yeah.
So they would portray very extreme reactions to things. Like they don't take well to criticism. They have a very sort of flawed sense of attachment sometimes to people. They have sort of like extreme degrees of values of self. Like one moment they don't see perceive self-value, the other moment they do. They just, again, their personality is again borderline, right? So it's like you never know what to expect from this person. But in the truest form, they're also just attention seekers. Although they could actually go through with some of these things, like the suicide and the slitting of the wrists and stuff like that. And then the last, again, I'm just vaguely giving sort of characteristics of these people, but yeah, you can just feel free to look through like the actual points in those manuals. Then the last personality disorder in there, I'm sorry, I've forgotten, but I know I have notes somewhere here. Let's see, what was that one? Ah, yes, the antisocial personality disorder.
Okay.
So this person doesn't really care much for people either. They have no remorse, basically. They tend to engage in actions that are deemed unlawful and can usually end up in trouble with the law. They steal, they can be aggressive, they do things that sort of cross the boundaries between like invading people's rights and just doing whatever it is to people that they want without any, without caring about the repercussions. Yeah.
Okay.
They are. Think of this person as just like the overly aggressive, excessive bully who does whatever they want without a reason.
Question. That's actually interesting, because that means in layman's terms, we have completely misunderstood the definition of antisocial disorder. Because when people say, oh, I'm antisocial, it means I don't like being around, I just want to be at home. Like it means it's used like synonymously with introverted, right? So it's like, oh girl, I'm just so antisocial. That doesn't sound like that at all. Like that's not what it sounds like.
Well, definitely not the personality disorder. Yeah, true.
Okay.
We the way we use it is definitely in terms of we are aloof and stay in our rooms.
Yeah.
And don't care much to talk to people. So when we're talking about antisocial personality disorder, that is definitely not
a completely different thing. Okay.
It's a completely different thing.
I'm with you.
True.
Right. Okay, so then you were saying there, so you said there are two clusters. So we did A and B. And then there's, I mean, you said there's C.
The last one is C, and C has 3 in total as well. C is basically the anxiety-related sort of personality disorders. The first one you have is like the avoidant type, and that's just what it's called, avoidant personality disorder. This person, they want the social interaction, but they stay away from it because they're afraid of being overly criticized, or they're afraid of being judged.
Mm-hmm.
They think, for example, low of themselves. They think they're inept or can't really match other people. They're just afraid of a lot of criticism. Despite wanting to actually interact with people, they don't go out of their way to, because of all these inherent fears that they have.
Yeah.
So they avoid people,
Mm-hmm.
right? And it sucks because some people are like that. I guess this would be your antisocial to some degree if you want, but they don't. How do I say? Some people have these traits, but when it goes to the extremes where you have low self-esteem and literally go out of your way to not form relations, even though you want to, you would
Mm.
be classified into this group.
Okay. Okay.
So it's basically out of anxiety and fear of being judged and criticized and stuff like that.
Okay.
Um, that then the next disorder within this cluster would be the dependent personality disorder. And again, I think this person you've probably come across, or somebody with traits of, because this is someone who can't form their own opinions,
Okay.
is always looking to people to see what they think about a certain situation,
Okay.
even though this is a decision that the person should make about themselves for themselves. They would still look to somebody else to make that decision for them. So the dependent personality disorder, these are people that are extremely clingy. They can't form opinions of their own. They constantly look to people to make decisions for their lives, like regarding finances or anything major, really. They just find it difficult to make the choice themselves and would rather rely on somebody else's choice
Yeah.
rather than themselves. Yeah, and it sucks because they constantly feel like without that support or without that person in their life, they can't function. So these people, for example, you've ever heard of somebody who just can't stay out of a relationship? Like they move from one relationship to the next because they just have to be in a relationship. Not to say those people have dependent personality disorders, but some of these people show these traits
Yeah.
where they constantly need their significant other to be there and help them, support them in things that they should generally be able to do themselves. Yeah.
Validate
And,
decisions. Also to
yeah,
validate their
exactly.
decisions and their choices.
Yep. So they don't feel comfortable making that choice themselves. They always feel like somebody that they regard highly should make that choice for them. And I guess you can see how this can become a problem, especially if somebody wants to take advantage of such a person. But also on top of that, these people, they go out of their way to avoid confrontations with this person that they perceive as high value or something like that.
Okay.
So let's say I identify with my mother as such a person. Yeah, let's say I'm always asking for my mom's advice on things. I don't really do much unless she's there. I don't go to the shop unless she's with me, something like that, right?
Okay.
I avoid arguments with my mom because I feel like after that argument she wouldn't want to be with me anymore, and then I can't function without that person.
Okay.
So these people are highly dependent on the people they form attachments with. So they're super clingy. And then the last cluster C disorder would be, I think, let me quickly check. Yes. So the last personality disorder is the obsessive compulsive disorder. Not to confuse with obsessive compulsive personality disorder, and this shouldn't be confused with obsessive compulsive disorder.
Okay.
They sound the same, but
Yes.
they aren't really.
Okay.
So how do I do this? Okay, so obsessive compulsive disorder, right? It has its own set of criteria that you should meet. Yeah. Let's say you lock your door at night and you go upstairs to your room to sleep, right? 2 minutes later, you're just like, did I really lock that door?
Okay. Yeah.
You know you really locked it, right? And you're just like, oh my God, you can't sleep now because that thought is continuously intruding your sense of like your
Turning and
yeah,
repeating.
it's just there. You can't sleep unless you deal with it. So now you have to go downstairs again just to double check that you locked your door, right? That would be a trait of somebody with an obsessive compulsive disorder. it's you have these thoughts that like sort of like intrude, and you can't get rid of them until you act on it, something like
Okay, so
that.
they're just like going in a, it's like it's continuously
Yeah,
tormenting.
it's like it just continuously, it just keeps
Yeah,
happening over the course of the day. Did I
yeah.
really wash my hands, or am I just
Mm-hmm.
imagining it? Stuff like that. And
Mm-hmm.
again, there's a lot more to it than that, but I think that's one of the best examples I can give.
Mm-hmm.
While somebody with obsessive compulsive personality disorder, so with obsessive compulsive disorder, this is someone who wants to be in control a lot. Not that it's a bad thing, but it can get bad, and they can sort of imagine, they can become aware of it sometimes, and sometimes people end up pointing it out if it becomes excessive. This is someone who, for example, when you're in a team or you're working together towards a certain goal, they want to be in control of every step, every process, everything that happens. They want to control exactly how you do something, and sometimes to the point that they rather would do it themselves because they don't trust that somebody would do it the way they want it to be done, right?
Mm-hmm.
So sometimes these people take the group leader role by themselves, even though they were not appointed or something like that, and they can't feel in control unless they're in control,
Okay.
something like that.
Yeah.
So it's I think some people have that to some mild degree, and others have it to like an extreme degree.
Mm-hmm.
So to the point that you can't even sleep unless you call Julie to make sure that she arranged the drinks exactly the way you wanted her to. Um,
Mm-hmm.
they're a team. They're not really a team player because they still want to hoard most of everything. In fact, if they could do it themselves, they would.
Yeah.
So these people just like things to be done the way they want it to be done, and that's final. So I think that's, in general terms, like the three clusters of personality disorders that are there, and just brief descriptions of some of the traits that they have. Like, there's definitely a lot more into it, and to some degree, you have to sort of read a little more in depth to be
Yeah.
able to differentiate all of them. But I try to give, like, as the broadest differentiations that I could find between the traits.
Mm-hmm.
So they're quite interesting. But like I said, I'm pretty sure a lot of us have small traits of all of these to some degree, but it's just, it becomes a disorder when either you yourself think it's too much, or people around you start talking to you and saying, I think you went a little bit overboard there.
Yeah.
Then you probably need to seek like an actual psychiatrist's help, to help you either diagnose what's going on, or to just be like, no, I think you just need to rest, or you need to see a psychologist, or you're maybe just stressed in the moment about so and so, and yeah, we'll move on from there. If
Okay.
treatment is needed, then they'll definitely recommend the
Recommended.
treatment. But yeah, I think that's where the professional takes over, like you said before.
Yeah. My goodness, thank you so much. I personally learned so much because I'm always telling people like go see someone and like take care of your mental health. But the clusters and all of this beyond me. But thank you so much. I really appreciate it, and I really appreciate that you would join me in this journey. Um,
Mm,
I'm trying very hard to, through this channel, through my writing and all of that, general day-to-day conversation, to destigmatize issues around mental health, mental wellness, promote mental wellness, and yeah, destigmatize the ideas and the feel and the vibe around mental illness and
yeah.
personality disorders, etc. So thank you very much for this. I just want to close this off by saying that, of course, there is never a time when you should give up on yourself. If you
Mm,
feel like, as Alex was saying, like if you feel like you're in the deep end, you can still go see someone and get some help, and you can change. You can help. You, the medical professionals are trying to help get you back into a situation where you can function in society and you can live a happy, healthy life. And so please do that. If you see somebody is struggling, or you think that somebody is struggling with something or is afflicted by something, please contact the correct people. I'll put a link here to blog that I wrote about where you can get help for free, for subsidized cost, and then for obviously you need some medical aid or like lots of money in your bank. But there are options for everybody, and we should never write anyone off. Don't write yourself off. There is a full and happy life, no matter what you're going through, that is waiting for you on the other side of just getting some help. So thank you again, Alex. Thank you again, Dr. Ilunga. And we appreciate you, and we'll have you back on the channel definitely. If you have any questions for him, we can have him back, but we're going to have him back for something else as well, which we were talking about a little bit earlier. I think it's exciting. So thank you, and we'll see you again soon. Bye.
You're totally welcome. Bye.
Bye.